Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Colorado, and I offer online therapy via Skype for the treatment of anxiety disorders, including agoraphobia. So if you're looking for help from an online therapist for agoraphobia, then I invite you to contact me and tell me more about yourself and what you've tried so far, and then we can schedule some Skype therapy sessions if you would like to get help in overcoming your agoraphobia. So if you're suffering from agoraphobia, then it's clearly a tremendous advantage to be able to get help from an online therapist because it's so difficult to leave home. I work a lot with agoraphobics who are essentially housebound and sometimes have not left their house for years at a time. So it's very important that you find a good online therapist to work with. When you're selecting an online therapist, do make sure that they answer all your questions and that you feel comfortable with the person and also with the approach that they are offering for treating your agoraphobia. You have to find what feels right for you. That is by far the best guide. So I teach mindfulness therapy and also mindfulness-based exposure therapy specifically for working with agoraphobia and other phobias, including driving anxiety. Very often, people suffering from agoraphobia also have a very severe driving anxiety issue. So we tend to work with both of those things. Exposure therapy is really important. It's quite common sense, really. You need to be able to work with your specific anxiety and overcome that anxiety and manage that anxiety in those difficult situations. And you can only really do that by some form of exposure therapy. However, not all exposure therapy is the same. So more traditional ideas around exposure therapy are based on the idea of developing more and more familiarization, essentially desensitizing yourself to the situation through repeated exposure. And that can work to a certain extent, but it can also make things worse as well. So my recommendation is that you must combine the exposure therapy with very focused and practical training. So in mindfulness-based exposure therapy, we do a tremendous amount of training before you do the challenge. So we're not just relying on desensitization through repeated exposure, but rather we're learning how to specifically work with that anxiety that gets triggered before we do the exposure. So we learn how to neutralize those habitual anxiety reactions before you do the exposure challenge. And that is what I find to be the most effective approach. So in mindfulness-based exposure therapy, you will learn how to meditate on that particular challenge that you're doing in your list of challenges. You start with the challenge, you play it through in the mind, you imagine doing that challenge, whatever it is. It might be simply walking to the end of the street or going into a supermarket or it might be driving around the neighborhood. Whatever the challenge is, you imagine doing it before you do the challenge. You imagine doing the challenge and you watch specifically for those anxiety reactions. And then you learn how to meditate on the anxiety to fundamentally change how it operates in the mind. You learn to neutralize that anxiety. You learn to heal that anxiety by working with it using mindfulness. So mindfulness is a combination of very specific conscious awareness combined with compassion, which is a tremendously powerful healing force in the mind. So you find the anxiety emotion and you learn to sit with that emotion without becoming overwhelmed with it, without becoming identified with it, without becoming consumed by that anxiety. You learn to develop a space between you as the observer and the anxiety as an object in the mind that you can observe in very much the same way as you can observe a movie on a screen. You can see it as a separate object. You are not in the movie, you are watching the movie. So this is part of mindfulness training, learning to see the anxiety without becoming the anxiety. So you have to train. It won't happen by itself. But if you deliberately find the anxiety and then start to meditate on it, you will develop that space, that separation, so that you can see the anxiety but not be consumed by it. Now this has a very profound effect. When you develop what we call objective consciousness, which is a fundamental part of mindfulness, you essentially are taking the fuel source away from the anxiety. Because when you react to the anxiety and when you become identified with it, you end up feeding that anxiety and making it stronger and also preventing it from healing, which it is already trying to do. All emotional suffering is trying to heal, just like a wound is trying to heal itself in the body. So an emotional wound, like anxiety, is already trying to heal itself, but the reactivity prevents that from happening. So learning to cut off the fuel source is very important for the healing process, for neutralizing that anxiety. Then you bring in the response of compassion, which is the second major component of mindfulness. That is really learning how to form a compassionate and friendly relationship with the anxiety, seeing it as an object that needs you to help it heal, and then discovering, through being present with it mindfully, what will help it resolve itself. And there are lots of different aspects to this that I'll teach you during our Skype therapy sessions together, but it's quite surprising how effective that can be in also just developing this different kind of relationship, not based on fear, but based on compassion. When you can treat the anxiety with compassion, it greatly increases the rate of healing. So this is what we would do before we do any exposure challenges. We play through the challenge in the mind, we look for the anxiety, and we start to work with that anxiety in a way that neutralizes it, so that we can imagine doing the challenge with no anxiety at all. Then when you do the challenge, you will be reinforcing the training, and the effect will be much, much more effective than just throwing yourself into the situation without training. So when you approach agoraphobia in this way, you'll see results very quickly, and often people see dramatic improvements within a matter of a few weeks once you start working with your anxiety with mindfulness. If you'd like to learn more about mindfulness-based exposure therapy for treating agoraphobia and driving anxiety and other anxiety disorders, then please contact me and let's schedule a Skype therapy session. Go to my contact page and fill in the form, tell me more about yourself and any questions that you have, and then let's go ahead and schedule your first Skype therapy session, and you can see for yourself just how effective this approach is. So if you're looking for help for agoraphobia, please reach out to me. Thank you.